What I can tell you is I started, and this will be different for everyone, but after I had the IV and everything done, they need to take blood just to verify and double check the type and cross. And the first time they had done it, it verified with my own knowledge. I've done my own type and cross myself. One of the advantages of being a physician. I did receive IV Tylenol when I first started, and then I was given IV Versed to take the edge off. I know that's very popular. I thought it was amusing because I actually did not have any edge. I had absolutely zero apprehension, probably because I knew everything that needed to be done. So that's just the way I am. Obviously, everyone's going to be different. I do remember just barely feeling the effects of the Versed. I was looking at the video where I thought maybe I was slurring, but I wasn't slurring. I didn't feel like I was slowed down. Anyway, I said goodbye to my wife. They wheeled me back to the operating room area. The last thing I remember is seeing the operating room halls. The operating room's off to the left, and I was talking to the anesthesiologist. I was actually very conversational, which had him amused. And I'll be honest, I've done so many lumbar punctures myself. I didn't have any apprehension about that, but I didn't realize I was going to be giving the propofol before they did the spinal. For whatever reason, it never even occurred to me. Nevertheless, I remember talking to him. They took me back at 8:20. The next thing I actually remember, it was 11 o'clock in the morning. And so the surgery was over. I was told that it started about 9:06, thereabouts, and I was done at 10:20 because that's when Dr. Radaman came out to speak to my wife. Just as an aside, let me stop right there because Dr. Radaman, I did not find much information online when I was looking on Surface Hippie and I was looking on YouTube. I can tell you that as a professional, and I had done a lot of research, I can tell you that he is superb, excellent. I think he is a very good, knowledgeable physician. He's very compassionate. He's open to any questions. He's great. I have nothing but the highest regard and admiration, and I can't see anything better. I don't think this is because I was a physician. I think this is just the way he practices. I would highly recommend him. Actually, I actually have already. As I said, there are not many physicians that have the experience in the Orlando area, and I've let my own primary care physician know and other physicians, including orthopedists, when they need to find someone. I feel that I would totally trust him. And I did with myself, but I'm just telling you my personal experiences that he's superb. And also on the aside, regardless of the risk management, I'm going to skip forward a little bit, but I can tell you that I initially had thought that I needed to go to a large university-based hospital for this procedure. It's not done everywhere, and it is a fairly advanced procedure that's not commonplace. Due to personal circumstance, I was probably planning on going up to the Hospital of Special Surgery, which is a top-notch institution. Not that's the only one I would have gone to, but I know that Edwin Sue is a very well-known physician who has a lot of experience. And it's a large hospital that deals only with orthopedics. But I was a little concerned. Florida Hospital Wesley Chapel is an 80-bed hospital. It's fairly new, a year and a half, which sounds great, but I know from the medical side, training of personnel and support care, it takes a while in getting everything down right. And Dr. Radaman actually just moved his practice over there. To my pleasant surprise, I guess I can say, almost like I would say like a big chain, Marriott. I felt this was like a boutique hospital. I felt like everyone that I came in contact with was extremely friendly, attentive, and knew what they were doing and took care of whatever needs, and fairly prompt. It wasn't where they couldn't get to things. They were on the ball, They were very conscientious regarding hand washing, infection, about being very careful with all the maneuvers that I wouldn't get hurt, that they would take care of my needs. And I'm talking not just the nursing staff, which I thought was great, and they were very, very willing to help me with everything, but the nurses' aides, the physicians, the hospitalists, the anesthesiologists, they were all great, and I don't feel it's just because I was a physician. The dietitian, when they came to take my menu orders, he was great. It was sort of funny how nice I was being treated. The cleaning women, when they came in, what needed to be cleaned and what they were going to do, and just being so conversational. It was, it was like honest, part of the Seventh-day Adventists, but it was all part of the family. They were all there, and they were all caring, and everything was great. So, to be honest, I don't think I could have gotten better care anywhere else, and I was not expecting that necessarily to be the case. I trusted everything in Dr. Radaman, who I know in my own situation also, the person who's in charge will make sure things are done right, and if something's not done right, he'll make sure it gets done right. Here, I think everything was being done right anyway, and so pleasant surprise. So that's enough of that. So anyway, so I woke up at 11 o'clock, and I can tell you that when I woke up, first thing I noticed was that the anesthesia, well, it was still active, and I had more of a block in anesthesia on the operative left leg than the right. I was able to move the right leg. I could barely move my toes. I did have a second block, anesthetic block on the left, but so basically my leg was just lying there. I couldn't make it move if I wanted to, and did not wake up in pain, but I didn't expect to wake up in pain, so that really was an issue.